The healthy human brain manages its memory, cognitive, and motor functioning through complex electrical and chemical interactions mediated by multiple neurotransmitters. One of these neurotransmitters, called acetylcholine, mediates signal transmission at a variety of sites within the central nervous system. When an action potential reaches a synapse in a cholinergic neuron, vesicles release acetylcholine into the synaptic cleft. Acetylcholine then diffuses and binds to receptors on the postsynaptic neuron to propagate the action potential. This signaling process in the healthy brain is essential for proper functioning, including cognition and memory. Following this transfer, acetylcholinesterase degrades some acetylcholine. Alzheimer's disease is a neurodegenerative condition characterized by progressive deficits in memory and cognition, leading to impairment in the ability to perform activities of daily living. Alzheimer's disease is characterized by the accumulation of proteins into plaques and intracellular tangles, and reduced neuronal cholinergic function. Studies suggest the reduced function of the cholinergic system may contribute significantly to the clinical manifestations of Alzheimer's disease, including cognitive impairment and memory loss. Aricept, the only treatment approved for all Alzheimer's disease stages, mild, moderate, and severe, is an inhibitor of the enzyme acetylcholinesterase. Aricept is hypothesized to bind to acetylcholinesterase to inhibit the degradation of acetylcholine. As a result, Aricept is believed to reduce the levels of acetylcholine degradation within the synaptic cleft. This may enhance cholinergic function and may account for the therapeutic effects of Aricept observed in many patients.
Aricept is indicated for the treatment of dementia of the Alzheimer's type. Efficacy has been demonstrated in patients with mild to moderate Alzheimer's disease as well as in patients with severe Alzheimer's disease. Cholinesterase inhibitors have the potential to increase gastric acid secretion. Patients at risk for developing ulcers, including those receiving concurrent NSAIDs, should be monitored closely for gastrointestinal bleeding. In clinical trials, syncopal episodes have been reported, 2% for Aricept versus 1% for placebo. In clinical trials, the most common adverse events seen with Aricept were nausea, diarrhea, insomnia, vomiting, muscle cramps, fatigue, anorexia, and ecchymosis. In studies, these were usually mild and transient. For full prescribing information, please visit www.aricept.com/pi.html.